Hypertension, also known as high blood pressure. Blood pressure is the force of blood moving throughout your body. Your blood pressure is made up of two numbers. The top number is known as the systolic. The number on the bottom is called the diastolic. How would you even know if you have high blood pressure? According to the American Heart Association, normal blood pressure is anything under 120/80. Blood pressure is typically considered high when the top number is at 130 and the bottom number is above 80. There are two types of hypertension: primary hypertension and secondary hypertension. Primary hypertension is high blood pressure that has no secondary cause. It is the most common type of hypertension and is thought to be linked to genetics, poor diet, lack of exercise, and obesity. Secondary hypertension is high blood pressure that is brought on by another disease. Many different diseases lead to the contribution of secondary hypertension. Here are a few of those. Here is an illustration of the effect that high blood pressure can have on your arteries. It is very important to have your blood pressure checked regularly. Some people go years without any signs of high blood pressure. If you have been prescribed medication for high blood pressure, it is the utmost importance to continue the medication and do not miss a dose. Keeping a daily log of your blood pressure is a good thing, but that log needs to be given to a doctor for further evaluation. Ask your doctor how to properly keep a record of your blood pressure at home. Compare the readings of your blood pressure at home to the readings at the doctor's office. The anxiety of being in a doctor's office commonly causes a spike in blood pressure, known as white coat syndrome. Here are some tips and tricks of recording your blood pressure at home. There are several signs and symptoms of high blood pressure, but many times high blood pressure will be asymptomatic, which means there are no signs at all. Regular blood pressure checks are the only way of determining hypertension. Our local area is about average compared to Alabama as a whole when it comes to the risk factors for high blood pressure. Hypertension does not have to be a lifelong battle. Here are a few tips to help you lower your blood pressure. Those include losing weight, exercising at least 30 minutes a day, limiting alcohol, and quitting smoking. Along with cutting out risk factors and exercising, a heart-healthy diet is recommended when fighting high blood pressure. Make sure to eat your fruits, vegetables, low-fat dairy, nuts, legumes, skinless poultry and fish, and non-tropical vegetable oils. Of course, when there are good foods, there are always bad foods. Here are a list of foods to avoid when trying to stay heart healthy. Other than food, certain medications can also increase your blood pressure. Please ask your doctor about any medications that you may be taking that could cause a rise in your blood pressure. And always, avoid recreational drugs. Complications from uncontrolled high blood pressure are often severe and nothing to take lightly. Please contact your doctor if you feel that you have hypertension. To summarize, High blood pressure is very common, but can be hard to identify until other issues become present, and then it may be too late. Your blood pressure should be taken at each visit with your doctor. If your blood pressure is high, the doctor may recommend a blood pressure machine that is good for home use. A heart-healthy diet is very important when reducing the risk for high blood pressure. Exercising daily, at least 30 minutes, is recommended. If high blood pressure is left untreated, it can lead to other life-threatening diseases and even death. Thank you so much for watching. We truly hope you enjoyed. Reference.